Hello and welcome to On Call with the Prairie Doc After Hours. Well, we had many great questions submitted over beyond the time that we could answer during the broadcast. So let's get started and see if we can get all those answered. A woman from Aberdeen asks, I used to have migraines and family doctor prescribed 2 milligrams of diazepam with fiorinol and sleep, and they go away overnight. Daughter now has headaches. Would the cocktail help? I've done that. But I don't use, I didn't use diazepam. I would use a short-acting benzo, but I wouldn't give many of them. And then I would hit them with a significant dose of a narcotic and just put them to sleep, and then the headaches go away after sleep.
Yeah, so those therapies are pretty old therapies before we had the more migraine-specific therapies. So fiorinol and Fioricet. They both have a barbiturate, they both have caffeine, and then one has Tylenol and one has aspirin. So the fiorinol has aspirin instead of Tylenol. Those medications, the fiorinol and Fioricet, are big rebounders, and you have to be really careful.
Really
and
double, triple rebound.
Right, and there's a barbiturate in it, so there's some addiction potential. I do use them sometimes. I would usually use those if the person has some reason that I can't use the triptan category, like if they're over 60, I don't love to use the triptans. If they've had a stroke or heart attack, or if they've had problems with the triptans. The benzos, I don't really prescribe those. It's somebody that's been on it for a long time, it would be hard to get them off, but it's certainly not first line anymore because there's so many new therapies. Back in the day, that was probably all they had.
Right.
Yeah.
We're just finding a way to get them to sleep.
Right, sleep is so important for headaches. So
actually,
yeah.
I think I had moved from the diazepams to Vistaril.
Oh.
And so I hit him with 100 of Vistaril, 150 of Vistaril, and then a narcotic of some kind.
You know, and people could use Benadryl to help them sleep because that helps with the headache as well. However, there's complications from being on that every night too.
You're falling on your face on the way to the bathroom.
Right.
You know, whenever you do this, there is a danger that they will hurt
And
themselves.
if somebody was needing something every night, the fiorinol and the diazepam, they probably need a preventive medication. Yeah. And so for your daughter, I would want to start fresh, and I wouldn't start with those necessarily. I would want to get a good story and see where do we need to be. There's just so many new medications that are better.
Get your daughter in to see Carol.
Yes.
That's it. My wife is 76 years old and has developed almost constant headaches since falling on the floor and hitting her head almost 3 months ago. For over a year, she's had a problem falling asleep while sitting at the kitchen table and has fallen twice. She was diagnosed having a concussion and had a CT scan that didn't show any bleed or any other abnormalities. She's scheduled to have a sleep study and some daytime sleep tests. Any other ideas?
I think the sleep study sounds great because she's fallen asleep at the table, so there's something. And she's had at least one concussion. Post-concussion headaches can last a year and a half. We tend to see them go away in about 4 or 6 weeks or so, but they can last up to a year and a half. And you have to be really careful because you can take a post-concussive headache, start taking too much Tylenol or Excedrin,
and now you're hooked on
and
that.
now you've got medication overuse headaches. So that post-concussion headache goes away, but now you've developed medication overuse headaches. So you just need to treat it, and it goes away, but you have to make sure you're not using too many medications to treat it so that you're not allowing it to go away.
So sleep apnea, I think, really was one of those diagnoses that we knew when I was a resident. It was a brand new diagnosis. We had Pickwickian patient. I had one, and I took care of him, and he eventually ended up with a trach, problem solved, right? That he had a constant trach, so he could breathe when he lay down at night. He was a big, heavy guy. And it really helped him. There was no CPAP at that time, and I knew there was a lot of borderline kind of Pickwickian types of thing that was sleep apnea, and then they finally came to a diagnosis and a way that realized the real danger of all of the complications. People would die. A lot of people die from sleep apnea disorders. My question to you is how many headaches are from sleep apnea?
Do you know, it's probably overall in the headache population is probably relatively low because it tends to be, the headache population tends to be a little bit younger. But if somebody's developing headaches that didn't have them when they were younger, that's probably one of the first things you should be thinking about. Look at the medication list, make sure they're not doing something that could cause a headache. But sleep apnea is a big headache.
Or snorting.
Yeah, and falling asleep at the table. I think the number one thing is that sleep study for that person. Yeah.
I used to have an aura before a migraine. Now I just have the aura. Have you heard of this before? And is it something I should worry about?
As long as your aura is the same, you don't have to worry about it.
So what is an aura?
So an aura is, some people will get before they get the headache, sometimes during, they'll get about a 20-minute to up to a 2-hour episode where they'll have a visual aura, flashing lights, black jagged lines, black spots, shimmering. They can get any of those things. You can also have an aura where you have numbness or weakness on one side of the body or the other. But some people will have the migraine with aura, some people will have the migraine without aura, and some people will have the aura without migraine. So you can have the aura and not have a headache. And no, it's not concerning as long as the aura is very similar to the aura you had before.
Okay.
You're just lucky. You might just be kind of outgrowing them.
Outgrowing
the headache
headaches.
phase, yeah.
So what's the difference between a migraine and an ice cream headache?
So an ice cream headache is sort of really a subcategory of migraine type headache. It's all because the roof of the mouth is the trigeminal nerve. It triggers that and causes that sudden onset of pain that goes away as it warms back up again.
So it's a migraine headache, kind of a
like a mini version
migraine.
of it, right? Mm-hmm.
And so don't do that.
Yeah.
Is it ever? So it's an example of what a migraine could feel like
Right.
if
That's
it lasts
probably a
longer.
good way for other people to tell what that feels like, right?
And if you don't want ice cream headaches, don't eat ice cream.
Too fast.
Too fast. A woman from Brookings asked, what are your thoughts about neurologic chiropractic care and migraines?
I am not versed in that at all. I'm not sure what their training is for it. I will say that there are certain headaches that we see from a vertebral artery dissection. The arteries at the back of the neck run up between the bone, and if you have a sudden rapid acceleration either way, you can tear those vessels. And so we see that every year. There's thousands upon thousands of chiropractic manipulations, even in Sioux Falls or in this area, every year. But we see probably 3 or 4 strokes that come from that. So I discourage my patients from getting the neck manipulation because I've been on the other side of these stroke patients. So I really don't know what neurologic chiropractics is. I don't know what their training is. I don't know that answer.
I would say, though, that a lot of headaches are due to the medicine that we're using, or they're using, probably. Some of it's prescription from physicians that have brought it on, and the chiropractors are commonly trying to give an alternative of avoiding medicine, which I think can be a very good thing.
Well, and in headache medicine specifically, anything that's minimizing your medication use is good, but you have to weigh the risks and the benefits. Yeah.
And I think there are chiropractors who are knowledgeable about avoiding that neck.
Exactly.
They've
I have a lot of
learned.
Patients who will say my chiropractor is not doing that on my neck, and so that's good.
And it's like, I think, using acupuncture, a non-medicinal kind of therapies for headaches, if they can help, if they're working.
Which is the same place that you would throw exercise in as well.
Exactly.
Any of those things, yep.
So how helpful are pain management clinics?
I use some pain management clinics for the patients that I really can't get control of their pain. And sometimes when people have pain for so long, there's other aspects that come into it. They can get addicted to the narcotics. They can have all kinds of side effects from the narcotics or the other medications. And then they potentially don't have their job anymore, and it becomes very difficult. And at that point, I need somebody who can take them in and do all aspects. Manage the medications, manage the psychiatric aspect of it, manage the physical therapy, and a lot of times those pain clinics will have all of those aspects in it. The Mayo Clinic has a fabulous one where it's all encompassing. and they meet with pharmacy and everybody while they're there, and they're good clinics.
I'll give you, that's a good thing.
Yeah.
And then there are pain clinics that just give you narcotics and write the prescription, see you later. Or they'll inject over amounts of steroids, and they do procedures, and it just generates a lot of money.
Yeah, too many steroids are going to add some risk too.
So I think about the clinics for headache or for chronic pain are oftentimes a lot like some doctors. Some are really good.
Right.
Some are okay.
Really good point. Depends on where you're going.
And in follow-up of that, at what point should a headache sufferer consider going to a place like the Diamond Clinic in Chicago?
So I consider the Diamond kind of when I would consider Mayo. They're oftentimes when they've been through their primary care physician, and then maybe they've gone through general neurology, or maybe they've gone through the headache clinic. And if we're just really not getting anywhere, sometimes we need somebody to take a nice fresh look and give us their ideas
and so
as well.
They're evidence-based, solid science people then.
The Diamond Headache Clinic, yes. They do a lot of research. They write a lot of the articles, yeah.
That's really good.
Yeah.
I wake up with horrendous headaches with constant throbbing. I've noticed that sodium will spark them. Is it allergies, stress?
So people that wake up with headaches, it's usually, there's a few different things. One, if they're fresh and new, again, waking up with a headache, that's something you would think of a tumor. So when they're brand new, you would want to rule that out. There's so many other things that can cause it that you don't need to worry about it, but you definitely need to go in and get that looked at. The most common time for a migraine to occur is 4 o'clock in the morning. For some reason with our circadian rhythms, it peaks at 4 o'clock.
Which is the lowest dose of corticosteroid.
Which is probably what happens. And then at about 7 o'clock it goes down. So a lot of times people will wake up maybe even a couple hours into a headache, and so they're hard to treat because they missed the beginning. So with the ones that they wake up with, it's probably migraine. You can also wake up with medication overuse headaches. If you're taking Excedrin and every 4 hours you're taking Excedrin and then you sleep for 6 hours, you miss that 4 hour point. And so then you wake up with a headache because your head is asking again for it. So there's different reasons you can wake up with a headache.
Or it was the three glasses of scotch that they had before they went to bed.
Right.
That red wine that they had.
Or they didn't sleep and then they're going to wake up with a headache. Those are all reasons to wake up. But the really severe ones, that makes me think it's probably migraine. And it doesn't necessarily follow with allergies, but allergies kind of follow with when the weather is changing. So again, that barometric pressure change. Certainly if you've got allergies and you're clogging up, that's going to cause a headache too, but you should be clogging up. And there's a lot of crossover between headache specialist and ear, nose, and throat and allergist, and we're sending patients back and forth all the time to rule all those three things out.
Sodium.
I'm not sure about that. I've never read that sodium is bad, except that those aged meats have a lot of sodium in them, and those are bad.
Let's talk about that. So the classic is ham.
Ham and pepperoni, salami.
Right, but there's more than salt that's in that
right.
ham. The nitrates, right?
Right, and so it's probably the nitrates that's doing that. Yep, it's
that's that preservation type of a thing that you can put in meat.
That would be my guess. I don't know what they're getting in their sodium, unless their blood pressure is bumping up. But I think you'd probably have to have quite a bit. But
so I don't have a good answer. You and I are kind of playing with that, but we don't have good answers to that question. Good question.
Yeah.
In fact, all of these were great questions. That was the last one. We so appreciate those questions. And Carol Nelson, thank you for so much for having.
It was fun. This is fun to do.
Appreciate you being a volunteer to do this. And we thank you for joining us on our Facebook page. We appreciate all your questions and the opportunity to answer them. Until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.